I'm Amber Pierce, and I'm going to be doing a physical assessment on my patient for Nursing 360. I've washed my hands and done my patient's vital signs. We have a blood pressure of 110/60, pulse of 80, respirations are 14, and temperature is 98.6. The patient is 47 inches tall. His weight is 79.8, which would give him a BMI of 25 if we wanted to calculate it. However, it is not recommended to use a BMI with children. Tyson, do you have any questions before we begin the exam?
No.
Okay. Do you know your name?
Tyson James Ashby.
Do you know your birthday?
November 21st, 2000.
Do you know where you're at?
A false clinical setting.
And why are you here today?
To help my mom get an A.
Excellent. And do you know who the President of the United States is?
Barack Obama.
And do you know what season it is outside?
Winter.
Okay. So patient is alert and oriented ×3, and I will be assessing mood and cognition throughout the exam. And again, I've washed my hands, and I'm going to go ahead and start with checking your scalp. I'm going to be palpating your scalp at the same time that I am checking for any lesions, dryness, or tenderness. I'm also checking for any lice as I go. Excellent. Tyson, I'm going to palpate your sternomastoid muscle here, your paraspinous muscle here at the back of your neck, and your trapezius muscles. You have two of them. All right, good. Tyson, I'm going to check cranial nerve 1. If you could close your eyes, I'm going to give you something to smell, and if you could tell me what you think you're smelling. Close your eyes, please. Do you smell anything?
Mm-hmm.
What do you smell?
Peanut butter.
That'll work. All right. I'm going to check cranial nerve 7. If you could puff out your cheeks for me and smile and frown and raise your eyebrows up for me. Excellent. Okay. Tyson, if you could also go ahead and take a nice sniff in. Okay. And again. Excellent. You have a patent airway. I'm going to palpate your nose. I'm looking at the bridge of your nose here. I'm looking for any tenderness or swelling. I see and feel none. Your nares are nice and symmetrical and even on your face. I'm going to check your nodes. I'm going to start with your preauricle nodes, postauricle nodes, occipital nodes, your superficial cervical nodes, tonsillar nodes, submandibular nodes, submental nodes, posterior cervical nodes, supraclavicular nodes, and your deep cervical chain here. Excellent. Okay. Tyson, I'm going to move on now to your ear. I'm going to note that the pinna is level with the lateral canthus of the eye. I'm going to palpate the pinna. I'm pushing on the tragus for tenderness. And I'm inspecting the auricle, looking for any dryness, drainage, redness, or swelling. Tyson, I'm going to check cranial nerve 8. If you could cover that ear for me, I'm going to say 3 words to you, and if you could repeat them back to me.
Car, star, bar.
Excellent. And if you could cover this ear, I'm going to go over here and do the same thing.
Cat, bat, rat.
Excellent. And again, I'm going to note that the pinna is level with the lateral canthus of the eye. I'm going to palpate the pinna, push on the tragus, and I'm inspecting the auricle for any drainage, redness, or swelling. I'm going to come back into the front of your face, Tyson, and I'm going to check cranial nerve 5. If you could clench your jaw for me. I'm going to feel your temporal muscle as well as your masseter muscle. And if you could move your jaw from side to side for me. Excellent. That tells me that the motor is intact. And if you could close your eyes now and tell me when you feel me touching you, we'll check the sensory.
Now. Yeah.
Excellent. Okay, Tyson, we are going to check your eyes at this point. At this time, we are going to note that they are symmetrical on your face, and your eyebrows are nice and full. There's no scaliness, no bald spots. Your eyelashes are nice and full, and there is no redness or swelling. Your eyelashes are clear of any debris, no tearing noted. I'm going to check your vision, which is your cranial nerve 2. I'm going to do that with my Snellen chart. If you could cover one eye with this paper and read me this line while I hold this here about 14 inches from your face. Go ahead.
4, 2, 4, 7, 3, 9.
Okay, and if you could cover the other side and go ahead and read just this number here again for me.
4, 2, 4, 7, 3, 9.
Excellent. So that says that you have 20/20 vision, Tyson. And then if we could take this, and I want you to look straight at my nose, and I'm going to do a cover-uncover test. Excellent. Excellent. Okay. Tyson, I'm also going to check cranial nerve 3, do some pupillary light. I'm looking to see how your pupils constrict. I'm just going to shine this light right in your eyes. Look straight at my nose for me. Excellent. Excellent. Then I'm going to check for the red light reflex. Excellent. Excellent. Okay, Tyson, I'm also going to be checking cranial nerves 3, 4, and 6 at this time. I'm going to do that with an H test. I need you to look straight at my nose and just have your eyes follow my finger. Checking the motor muscles of the eye here. Excellent. Good job. Tyson, can I check your mouth, please? Okay, I see no redness, no swelling, no drainage, no sores, no lacerations of any kind. And Tyson, if you could go ahead and we're going to check cranial nerves 9 and 10. We're going to do that by having you go ahead and swallow. Okay, and stick your tongue out and say, ah, ah. Excellent. Okay, now if you could go ahead, we're going to check cranial nerve 12. If you could go ahead and move your tongue side to side. Excellent. And say, la, la, la.
La, la, la.
Excellent. Okay. We're going to go ahead and note also that your lips are a nice coral color. They're dry and chapped, but they are not cracked or bleeding. I'm going to palpate the lacrimal gland while we're up here. And I'm going to look down at the, if you could look straight up at the sky, I'm going to check the conjunctiva. There is no drainage swelling noted. And we are going to move on at this point and listen to your breath sounds. We're going to note that your trachea is nice and midline here, and your chest is nice in a 2-to-1 ratio. Can you take a nice swallow for me while I check your thyroid here? Excellent. Okay. I'm going to grab my stethoscope, Tyson. We are going to listen to your posterior breath sounds. We'll be listening to your bronchial vesicular sounds first. Nice deep breath. Deep breath. Okay, go. And one more. Excellent. Past the intercostal space 1 and 2, we were listening to vesicular breath sounds. Tyson, I'm going to place my hands on your back here at the costal vertebral angle. If you could take a nice deep breath in so I can see the symmetry of your chest with inspiration.
I'm bleeding.
Excellent. And Tyson, I'm just going to go ahead and do some percussion here at the costal vertebral angle. Great. Checking for any kidney tenderness there. We're going to listen to your anterior breath sounds. Tyson, we're going to listen to, again, bronchial vesicular sounds first. Go ahead and take a nice deep breath in. Go ahead. And we're moving on to this vesicular sounds. Great. Okay, Tyson, if you could go ahead and lay back for me. We're going to listen to your heart valves. We're going to start by listening to the aortic valve, which is at the second intercostal space, right sternal border. And the pulmonic valve, which is at the second intercostal space, left sternal border. Herb's point, third intercostal space, left sternal border. The tricuspid valve at the fifth intercostal space, right, left sternal border. And the mitral valve, which is at the fifth intercostal space, left midclavicular line. Okay, we've listened with the diaphragm of our stethoscope for the high-pitched noises. Now we're going to listen with the bell for the low-pitched noises. Okay, I'm going to listen to the carotid arteries. Excellent. And Tyson, I'm just going to palpate those areas looking for any thrills. And I'm also going to palpate the PMI here at the fifth intercostal space, mid and left midclavicular line. Great. Okay, Tyson, I'm just going to move on right into your abdomen from here. I'm going to note that your abdomen is nice and symmetrical, nice and flat. I see no masses. Color is good. I see no scars. And I'm going to listen to the four quadrants of your stomach, noting that this is the epigastric region. You've got your suprapubic region here, you've got your umbilicus region here, and I'm going to go ahead and listen before I do any touching, okay? In the right upper quadrant, the left upper quadrant, the left lower quadrant, and the right lower quadrant. Okay, I'm going to listen to the aorta with my bell, as well as the renals. Okay. Tyson, I'm going to go ahead and do some light palpation here. I'm going to start here in your right upper quadrant, where you have your liver and your gallbladder, as well as the head of your pancreas. Move over to the left upper quadrant, where you have the stomach, the spleen, and the body of your pancreas. Moving down to the left lower quadrant, where you have your descending colon. I'm going to palpate the umbilicus. I'm going to note that you have your bladder here about midline in the suprapubic area. And in the right lower quadrant, I'm going to tell you you have your appendix, your cecum, and your ascending colon. I'm going to do a deeper palpation now, Tyson. Just breathe easy for me. Palpating in all four quadrants. Excellent. Okay. Tyson, you also have some kidneys here. I'm going to slip my hand back here at the 12th rib and the costal vertebral angle and take a nice deep breath in for me. Push you up here. Excellent. I'm going to move around and do the same thing over here on the other side. Again, I'm looking for the 12th rib here. Costal vertebral angle. Take a nice deep breath in for me while I push up here a little. Okay, good. Okay. Tyson, I'm going to go ahead and I'm going to palpate for your femoral pulses here. Nice and equal on both sides. Okay, I'm going to have you go ahead and sit up for me. Let's move on down there. We're going to do some range of motion now. First, we're going to check cranial nerve 11, the trigeminal nerve. If you could push your face against my hand. Great, and do it again on this side. Excellent, and shrug your shoulders for me. Excellent, okay. Now can you move your head forwards, backwards? Okay, and can you move it side to side like this for me? Okay, great. All right, sit up nice and tall. Can you put your arms out like this for me? And can you push down on my hands? Great, and push up on the hands. Great, let's do some external rotation. Put your hands behind your head. Some internal rotation. Put your hands behind your back. Excellent. Put your hands up like this, like you want to box with me. Push against my hands. Good. Pull against my hands. Good job. Can you feel this equally on both sides?
Yes.
And can you feel this equally on both sides?
Yes.
Excellent. Let's go ahead and lower your arms. I'm going to check your brachial pulse here. And radial pulse. Excellent. Let's go ahead and flex your wrists against my hands. Up towards the body. Great. And down towards there. Good. Spread your fingers out for me. Don't let me push your fingers together. Excellent. Okay. If you could grab my two fingers and squeeze. Good job. Okay. You gotta let go. We're gonna leave your hands up in a half a fist here and close your eyes for me. Tell me when you feel me touching you. Close your eyes for me, please.
Now. 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 Now.
Excellent. Turn your hands over for me and we'll check capillary refill. Excellent. And we are going to move on to the lower extremities. If you could go ahead and lay it back for me again. Okay. Okay. We're going to start by lifting your leg and we're going to lift it here at the hip. Excellent. We're going to bend at the knee. And if you could push your leg up to my hand. Okay. Push down to my hand. Good. Take this leg and push up to the ceiling. Excellent. Push down like you're going to put it on the ground. Excellent. Okay, relax. We're going to do some internal rotation, external rotation. We're going to do some adduction across the midline of the body. And we're going to come back and we're going to do some abduction away from the midline of the body. Excellent, Tyson. Now, can you feel this down the middle on both sides?
Yes.
Okay, equally on both sides?
Yes.
Great. Okay, we're going to do the same thing on this side. We are going to lift here at the hip. Excellent. Bend at the knee. Push on my hand. Good. Push down on the hand. Great. Kick the ceiling. Good. Push down on the table. Good job. Relax. We're going to do some internal rotation, some external rotation. We're going to relax and we're going to do some adduction across the midline of the body. Come back. We're going to do some abduction away from the body. Excellent, Tyson. Now, can you feel this on both sides equally?
Yes.
Excellent. We're going to go ahead and take your socks off. I'm going to check for your post-tibial pulses as well as your dorsalis pedis pulses. And I'm just going to go ahead and check your cap refill since we're right here. Excellent. Can you push your feet down on my hands? Good. Can you raise your feet up? Okay. Can you go ahead and sit up here on the end of the table for me? And we are going to come down here. I'm going to be checking your reflexes. I'm going to check the Babinski reflex. Please don't. Excellent. I'm going to go ahead and check the Achilles reflex. Okay. And I'm going to check the patellar reflex. Excellent. Okay. Tyson, if you could go ahead and stand up for me and put your hands straight out in front of you. We're going to be checking the Romberg test for cranial nerve 8. Can you close your eyes for me and count to 5?
1, 2, 3, 4, 5.
And go ahead and put your arms out to the side and count to 5 again.
1, 2, 3, 4, 5.
Excellent. Now if you could turn to the side, go ahead and take your finger and touch your nose, and then take your pinky and touch your nose. Excellent. And then if you could turn to the side, and if you could do a heel to toe walk all the way to me. Go ahead and walk heel to toe to me. Good. Now if you could turn around and do a heel walk back to the table. Good. Now turn around and do a tiptoe walk back to me. Great. And if you could squat down and do a duck walk back to me again. And stand up. And that completes my physical assessment for Nursing 360.